was a rousing call to do something on the heels of what many called a suicide crisis last month in Woodstock. And tonight, troubling stats from CAMH that solidify their cause. I'm Roshni Murthy. They're as young as grade 7, yet they're part of a troubling statistic, giving us a look at the pulse of youth in this province. CAMH releasing a new study today indicating that more and more youth than ever before have mental health issues.
Until you have gone through it yourself, you don't understand the impact it really has on your day-to-day life. Going to school is much more difficult. You have no self-esteem, you have no self-confidence, and it just makes day-to-day life a really hard time.
It's a silent struggle, but it's screaming for attention. Startling new research from CAMH finds 1/3 of students say they've experienced symptoms of anxiety and depression. That's a 10% increase over the last 2 years alone, and it's raising alarm bells.
That was very surprising. I mean, we all know that there's a high degree of stress out there. Adults experience it, youth experience it, but the large jump, I think, is significant.
And though 1 out of 5 of the grades 7 to 12 students surveyed say they visited a professional for help last year, it seems they want more resources. Woodstock brought that painful message home early last month when hundreds walked out of class, demanding more help after 5 suicides in that community. And this survey backs up their call. 28% of kids say they want the help, but don't know where or how to find it. Cass has overcome his mental health challenges and now works with helping youth develop their confidence. He's learned not only are resources lacking, but says so is the information about the ones that are actually available.
You don't actually understand how much or know how many resources and support systems are actually available to you until you reach out for them. But there's no one really coming up to you and saying, hey, if you're struggling, we have so-and-so resource available for you.
There's a lot of kids that are also reaching out that they just want to keep going in a positive way. Like I'm doing okay. And there aren't enough resources. And I think our society has really jumped in to say what we need to do is address things from a more proactive stance, because we're paying the price if we don't address it now.
And that's exactly what the TDSB says they are trying to do. They're in the early stages of creating a mental health database in order to get a better picture of their students, their struggles, and teaching them to cope.
The action in Woodstock is making us all sit down and talk about. You also want to get some trends, so how can you feel, what are the gaps? Are what we think are the gaps, the real gaps? So you want to collect data, but you have to do it really sensitively.
On the heels of what happened in Woodstock, the Ministry of Education said that they will be looking into mental health resources in this province to help kids in our schools. They did get back to us early this evening, and they did say that the government's top priority is the health and safety of our students, and we're committed to providing the right supports to children, youth, and their families when they need them to enable positive mental health. They also allude to their new health and physical activity curriculum, which was released in September of 2015. Roshni Murthy, City News.